Pratikcha Chand. I'm the FNP student for United States University, and today I will be doing head to toe mock examination as a part of my assignment for the university. And I have already obtained a written consent from my patient to make this video and upload it in the YouTube. And I would also like to get a verbal consent from you. Can I have a verbal consent from you to make a video, upload it in the YouTube as unlisted as a part of assignment, please?
Yes.
Thank you. I also got a verbal consent from him. And for today's, can I get your name, gender, and date of birth and age, please?
My name is Vishal Jain.
Do you identify yourself as a male or female?
I'm a male.
Okay. Your date of birth?
8/29/1990.
Okay. And your race?
My race is Asian Indian, and I'm 33.
Okay. And how do you pronounce yourself as?
He, him.
Okay. Thank you. For today's video, I will be making a video. This is totally a mock video. If we found like any abnormalities or anything during the videos, you should still be going to your PCP. I will not be doing, like, we will not be doing any treatment or any consultation over here. This is totally a mock video, just as a part of the university. Okay. And before starting the video, I would like to do the integrity check. So for the integrity check, I will show my ear. I don't have any earbuds. I just have my watch. I'll be using this watch as a timer, and I also promise that I will not use any outside resource to help me with this assessment. And before we start, I would do the 360 scan of the room and my other integrity and the equipment checks. So first I would like to show my equipments here. I have a Snellen jars, nothing is there, and all the other equipments over here, sanitizer. I have a blank sheet, my brain dump sheet over here. This is empty. Flipping the other side, this is empty. There is just a paper towel over there, and nothing over here. Just picking up that, and that is a mirror. Here's a chair. Rotating my chair. Nothing under there. Nothing in the chair. And over there, over here, the iPad. Just three. Nothing up. Nothing down. So there. Just a table over there. Nothing. Some fruits. Another table. Just a kitchen over there. Scan. Kitchen. And nothing here. And this is the chair where I'll be using to keep my iPad. Nothing in the front and nothing at the back of the chair. So can you stand up so I can see, because I don't want to. Okay, sounds good. You can have a seat. Thank you. And I would like to do a meter check for the thing. So the meter check, there is nothing on the front and back. And I don't know if you can see this, but there is nothing on my back. Nowhere. Up there, there's nothing. Just there. Make sure the camera is not second one more time, then we can start. Okay, can you stand up one more time just to make sure nothing is there? Perfect, thank you. Okay, go ahead and sit. Now I'm gonna use my paper and pen and just do some brain dump over here. Let me start my timer here. Okay. Okay, and again, I wash my hands. This big thing here. Sanitizing my hands over here. Okay, we are starting with the assessment first. Can you tell me your name, date of birth, age again?
My name is Vishal Chan, date of birth 8/29/1990, and I'm 33.
Okay, how do you identify your race as?
Asian Indian.
And your ethnicity?
Indian.
Why are you here today?
I'm here for my yearly exam.
Okay, do you have any concerns for today you want to talk about?
No.
Okay, so over here, patient does not have any issues or any concern. If they have one, like any concerns or any issues, then I'll be working on the HPI. I'll do a workout on HPI that includes like duration, onset, location, severity, quality, and severity, quality, duration, and any modifying factor, including the sign and symptoms of that complaint, like whatever the patient is complaining for, and we can work and do the assessment based on that one. But my patient is here for the wellness checkup, so no chief complaint, so we will just do the wellness visit over here. I'll start with the past medical history. Do you have any past medical history or any chronic illness?
No.
Okay. Do you have no past medical history? Do you have any allergy to any of the medication or any of?
No.
Okay, so here the patient does not have any allergy or any to any of the medication. So if the patient has any allergy to any of the medication or any food or anything, we will usually discuss about the severity, any reaction of that allergy, and then how severe is the allergy, what the patient is allergic for. And then do you take any medication including over the counter?
No.
Okay, the patient doesn't take any medication over here, but if he takes any medication including over the counter, I will ask for like the frequency, how often the patient is taking, doses, how much he is taking, and any how much and why he is taking for, whether the medication is being effective or not. And when was your last wellness checkup?
Last year.
Okay, when was your last dental visit?
3 months ago.
Okay, when was your last vision checkup?
Last year.
Okay, did they found any abnormalities during any of those checkups?
No.
Okay, do you have any history of mental illness, like bipolar, schizophrenia, depression, or anxiety?
No.
Okay, do you have any history, any surgical history? Have you ever had a surgery under any anesthesia or no anesthesia?
No.
Okay, and have you ever had been hospitalized?
No.
Okay, and no. Do you ever do you have any infectious disease? Like, have you ever been diagnosed with any of the infectious disease like HIV/AIDS, hepatitis, any of those things? No. Let me just use this one more time. This, maybe that one. No complaint. Infectious disease, no allergy, no surgical, no injuries, hospitalization, immunization. Have you ever had? Do you have all your childhood vaccination?
Yes.
What about the flu and COVID vaccine?
Yes.
Okay. And then, when do you usually do your testicular examination, self-testicular examination?
Yes.
Okay, over here we'll educate the patient about the testicular examination, which we usually do every month. We encourage the patient to do while taking a shower, usually on the same day of the month, with the soapy hands, and feel the balls, any nodes, anything, like if you find any nodes or any lumps, any abnormalities, just notify to your PCP. And for the female patient over here, we will ask last menstrual period. When was the last time she had menses? Is the patient pregnant? If she's pregnant, how old is the pregnancy? And how many children does she have before? And we will also educate the patient about self-breast examination, which is again will be done during the hot shower. Try to do it on the same day of the month in the shower, using both the hands, like to find like soapy hands, and just find in the breast like a circular motion and symmetrical way. If she found any lumps or any unusual lymph node, just notify to the patient, notify to the primary care. And also the breast examination is educated for both male and female. For the breast self examination, can be done both either male or female. They can be done, and just notify the PCP or your doctor, primary care doctor, if you find any lymph or any nodes on the breast. Okay, and are you sexually active?
Yes.
Like, are you active with like one partner, multiple partner,
One partner.
or with male or female?
Female.
Okay, do you use any contraceptive device?
No.
Okay, do you have, are you married?
Yes.
Do you have children?
Yes.
Okay, when was the last time you have done the STD test, like sexually transmitted disease test? Do you remember when was the last time you did that?
Last year.
Okay, so was it negative, positive?
It was negative.
Okay, so we did that one, and then injury, it's infectious disease. Now we will move on to the family history. Who do you have in your family right now?
I have my mom, my dad, and my younger brother.
Okay, so does any of your, like, does your mom and dad, does anybody have any of the medical history? How old is your dad?
My dad is 61.
Does he have any medical history?
No.
How old is your mom?
My mom is 52.
Is he alive?
Yes.
Does he have any medical history?
No.
Does your paternal grandfather, how about him? Is he alive?
He has passed.
Do you know the reason of passing?
Natural causes.
Natural cause. Okay, does he have any medical history?
He had no medical history.
Okay, what about your paternal grandmother? Does he have, like,
She has also passed. And no, she has not.
how old was she when she passed? Do you remember?
She was 74.
Do you know the reason of the death?
Natural causes.
Okay, any medical history? What about your maternal grandfather
No.
from your mom's side? Is he alive?
No.
How old was he when he
He-
passed?
He was 78.
Okay, cause of the death?
Natural causes.
Any medical history?
No.
Okay, how about your maternal grandfather? Is he alive?
No.
How old was he when he's dead? Do you know?
I believe it's 80.
Okay, does he have any, what was the cause of the death?
Also natural.
Okay, and does he have any past medical history?
No.
Okay, and you said you have a brother.
Yep.
Does he have any past medical history?
No.
No, okay, and do you have, you said you are married, do you have a wife?
Yes.
Any medical history?
No.
How old is she?
She is 31.
Any babies?
Yes, I have 2.
Okay, do they have any medical history, or does they have anything?
No.
Okay. So no medical history. So now we're gonna go to the review of system for the family history. So does any of your family like has a history of glaucoma or any cataract, any blurred vision, macular degeneration, anything?
No.
Okay. So for the cardiovascular, does any of your family has the diagnosis of stroke or atherosclerosis disease or the coronary artery disease?
No.
Okay, does any of your family member has a neurological disorder like syncope or seizure?
No.
Does any of your family member has an endocrinal disorder like hypothyroidism, hyperthyroidism, or a diabetic mellitus?
No.
Okay, does any of your family member has a GI disorder like gut problem, diverticulitis, peptic ulcer disease? No. Does any of your family member has a genitourinary like BPS, benign prostate hyperplasia, or any bladder infection?
No.
Okay. Does any of your family member has a mental health issue like schizophrenia, bipolar depression, anxiety?
No.
Does any of your family member has a respiratory disease like pulmonary disease like pneumonia or for the lungs disease, any of them has a pneumonia or oops, I written there. I have not even written there. Or like asthma.
No.
Okay, and does any of your family member has obesity?
No.
Does any of your family member has any kind of cancer, like breast cancer, bladder cancer, skin cancer, any type of cancer?
No.
Okay, and does any of your family member has allergic to any of the medication, food, or environment?
No allergies.
Does any of your family member has a bleeding disorder or like immunological lymphatic disorder like anemia, hemophilia, anything?
No.
Does any of your family member has a musculoskeletal disease like osteoarthritis or any osteopenia?
No.
Does any of your family member has history of substance abuse?
No.
Does any of your family member has a hereditary disorder like autism, Down syndrome, or any of those?
No.
I think that is all for the family history. Now I'm gonna go ahead and do the verbally like medical social history for the patient. So for that one, when were you born? Like what is like which place of where were you born?
I was born in Portland, Oregon.
Okay, and have you ever, what is your occupation?
I own my own business. I work from home.
Okay, are you married?
Yes.
Do you have babies?
Yes.
Have you ever served in military?
I've never served in the military.
Okay, and for whom do you live with in the house?
I live with my wife and 2 kids.
Do you live in the house, apartment, or?
I live in a house.
Okay, is your house 1 story, 2 story?
It's 2 stories.
On this story, like for the safety, does your stairs have like a rails or something?
Yes.
Okay, do you have a gun in the house?
No.
Do you feel safe in the house?
Yes.
Do you feel like we are being abused in the house?
No.
Okay. Then what else? What is your race or nationality?
I'm Asian Indian.
Okay. You said you live in the house. Do you have what is your hobbies? Like what do you do in your leisure time?
I like to play sports and hang out with my family.
Okay. How does your diet look like? Like do you follow any kind of diet or do you have any dietary restrictions?
I think I have a normal diet.
Okay. How many do you like? What do you think? How many glasses of water do you drink a day?
I want to say about 6 glasses a day.
Okay. Do you drink coffee or any energy drink or any caffeine?
No.
Okay. Do you drink alcohol?
No.
Have you ever been drink and drive?
No.
Been on drink and drive? No. Have you ever done any illicit drug abuse?
No.
Okay. And then any tobacco use?
No.
Okay. What does your sleeping habit looks like? Like, do you usually sleep normal? You have difficulty sleeping? You have excessive sleeping? What does your sleeping looks like?
I think I sleep normal.
Okay. And how many hours a day hours a night do you sleep?
I want to say 6 to 8.
Okay. Do you usually take nap on the day?
No.
No naps on the day. Okay. No naps on the day. Okay, then now we're gonna go ahead and do like a review of system. We're gonna do this verbally. For the review of the system, I'm gonna start with constitutional. For the constitutional, do you have any fever, aches, or unintentional weight gain or weight loss?
No.
For the HENT, do you have any blurred vision, difficulty seeing, any photophobia, or anything like that?
No.
Okay, for your ENT and mouth, do you have any sore throat, difficulty swallowing, any pain in the teeth, any hard time breathing, anything?
No.
Okay, for your cardiovascular, do you have any chest pain, like any chest pain, hard time breathing, like fluttery chest or anything?
No.
Now, for the respiratory, any shortness of breathing?
No.
Okay. For the respiratory, no cough, no shortness of breathing, no. For the GI, do you have any diarrhea, constipation, any GERD, any GI issues?
No.
What does your bowel habit looks like?
I think it's normal.
Regular?
Regular.
Do you go every day?
Yeah.
Okay. For your genitourinary system, do you have any pain during voiding and any discharges?
No.
No. For your endocrine system, do you have any thinning of your hair? Do you feel sweaty, like excessive hot or cold?
No.
Okay. For your, what else is left? For your psychiatric, do you feel stressed out, any anxiety, any depressed?
No.
For your neurological system, do you feel like weakness, feel like passing out or syncope?
No.
Okay, for your mental health or psychiatric, any depression or anxiety?
No.
Then what else? For your lymphatic system, do you easily bruise or bleed or like easily get the infection?
No.
Do you easily get sick?
No.
Does it take a long time for you to heal your body?
No.
No. Okay. And for your allergic or immunological, do you have any allergy to any of the food, environment, or anything like any food, drugs, or environmental allergy?
No allergies.
No allergies, nothing. And for your skin and the breast examination, do you note like you have any change in the skin, any nodules, any papules on your skin?
No.
No. Okay. Okay, now we're gonna go ahead and do the general examination. For the general examination, patient appears healthy, he looks clean, no body odor. Do you know the date today?
Today is December 12th.
Okay, who is the present president of United States of America?
The current president?
Yeah.
Joe Biden.
Okay, patient is alert and oriented times 4. He has a good cognition, no body odor, appears healthy. He is communicative, like nice and cooperative, communicative. He does not appear any stressed out or any anxious. Now I'm gonna, what is your height?
5'11".
Your weight?
230.
Okay, based on that, your BMI is 33, which is little higher, like higher than the normal BMI. So his BMI is on the above side. So, and over here, I am just verbally saying, usually we need to do the blood pressure. We are going to do the blood pressure on both arms, both sitting and standing, and we will be comparing the blood pressure. So his blood pressure is 132/80, normal, and his temperature is 97.5, SpO2 96 on room air, which is normal. Heart rate is 78, normal. Respiration rate is 18. So that is about the vitals. And for the visual acuity, so now I will be using the Snellen chart for the visual acuity. I'm just doing the vision test for him. So can you cover your one eyes and just read the third line, please?
GF.
Okay, and to cover the other side of the eye and read the other side.
GLQF.
Okay, then open up with both the hands and read the third line for me, please.
GLQF.
Okay, thank you. And now I did this. Now I'm gonna go ahead and do the skin examination. For the skin, his skin looks moisture, no dry skin, no redness, no rashes, no sinuses, like no skin discoloration, and sinuses, no jaundice, and no erythema. And for the hair, I'm looking at the skin turgor. For the skin turgor, normal skin turgor, like no elasticity for the skin turgor. Let me sanitize my hands since I'm sitting for a while. And then I'm gonna do the skin turgor. turgor. For the skin inspect, the skin turgor looks normal, no edema. Can I see your fingernails? No clubbing, no cyanosis, no tar staining. Capillary refill within 3 seconds. No hyperpigmentation, no discoloration, and no swelling. I did not see any scar, no vesicles, no tumor, and no navy, and no suspected tumor. So over here we'll look for the navy suspected tumor, and then we will do A, B, C, D, E, which is asymmetry, border, and then color, diameter, and evolvement. So if any of those, like any of the skin tumor or something look asymmetrical, or the diameter is more than usual, or then the color changes, so that can be a suspected, and we have to do the further evaluation for that. So for this patient, I did not see any of those, and no distribution is like no vesicular and purpuric lesion. So next, I'm gonna go ahead and do the HENT exam. So for the HENT exam, I'll start with the inspection. So for the inspection, for the head, the hair are short, evenly distributed. Like in the front part, I can see a little bit of thinning of the hair. On the back, it's normal, short and straight, like small straight hair. No rashes, no papules, no redness, no open wounds. And for the face, no erythematous, no swelling, and facial expression, he's just quiet, no anxiousness, he's not angry, and he's not smiling either. He's just giving us look, like now he's smiling. So for his eyebrows, the eyebrows are evenly distributed, the eyelashes are evenly distributed, and symmetrical face, head symmetrical, no deformities noted. And for that one, I see the head, and then for the palpation, I'm gonna go ahead and palpate your head. So the palpation, any pain or any tenderness? No pain, no tenderness, and no lumps, no extra masses in the head. No pain and no tenderness. I'm gonna go ahead and do the temporal artery over here. Palpating the temporal artery here. No tenderness, no pain. And then I'm gonna go and do the frontal lymph node and maxillary lymph node. Any pain or any tenderness. No pain, no tenderness. And now I'm gonna go ahead and do the cranial nerve. So the first cranial nerve is olfactory. So for the olfactory nerve, I'll be starting with the nose. For the nose, no deviated nasal septum, and then for the nares, clear, pink and moist, no discharge. And I will start with the smell. So for the smell, can you close your eyes, close your one ears, and tell me what smell is this?
Coffee.
And close your other other side one, and this. Tell me what is this?
Cinnamon.
Thank you. So he was able to differentiate both of the things. He was breathing normally while he was taking his breathing with the both normal ears. And now we're gonna do the cranial number 2, which is the optic nerve. So for the optic nerve, I'm gonna see his eyes inspection first. For the inspection, no discharge. Sclera white, no redness. Normal conjunctivite, no redness of the conjunctivita. Pupil are normal. And now I'm gonna do a direct and indirect light. For this, we're gonna dim the light, but I'm just gonna verbalize that we're gonna dim the light. I'm not actually doing. So I'm doing the direct and indirect light for the pupil constriction. And pupil is equally reactive to the light. So Perla is not positive over, like we can see, it's equally reactive for both the things. And for the vision, I already did the Snellen chart. So his vision is 20 by 20. He can see the chart. And the next one I'm gonna do for the eye is the ophthalmoscopic exam. So for the ophthalmoscopic exam, I'm gonna use my hands as safety. Again, the light should be dimmed. I'm not gonna dim the light over here, and I'm gonna using right to right and left to left. So for right to right, I'm gonna use my hands for safety. Open up his eyes. See the red reflex. See the red reflex. I can see no dilated arteries or vessel. Red reflex noted. Cup is to disc ratio is 1:3, and no woolen spot or nothing. Now the cranial number 3, which is oculomotor. So for the oculomotor, there is no, for the inspection, no exophthalmos, no ptosis. And now I'm gonna go ahead and do the oculomotor. So for the oculomotor, just please follow my finger over here. So just with the people, he was able to follow my finger, and other than the medial downward and the lateral, all the others are oculomotor. So cranial number 3, no nystagmus. When I saw for the I tested for the nystagmus, and no nystagmus present. And I'm gonna go ahead and do the convergence. So what's my pupil? Okay, so the pupil dilated and constructed while I was doing the convergence. And cranial number 4 is trochlear, which is medial and downward. So while I was doing that, he was able to follow me medial and downward. And the cranial number 5 is a trigeminal. For the trigeminal, I'm gonna do the jaw test over here. Tenderness of the jaw, and can you open up your mouth? So I'm gonna do a test for the TMJ joint. I did not hear a pop-up sound over there. So negative for TMJ joint tenderness. Any tenderness or any pain while opening? No. So I am gonna do the dull and sharp test in the cheek, in the forehead, cheek, and the jaw. So can you close your eyes and let me know if it is dull or sharp?
Dull. Sharp. Sharp. Dull.
Okay, he was able to tell the dull and sharp in the faces over there. So that is cranial number 5, trigeminal. For the cranial number 6, abducens, it was laterally. He was able to follow my finger. So for the cranial number 7 is facial. For that, raise your eyebrows. Okay, smile. I'm sure now. He was able to make his cheek like puffy cheeks, smile, and raise his eyebrow. So cranial number 8 is auditory. For the auditory, I'm gonna go ahead and visually inspect first your ear. No discharge, no tenderness, no lymph node or anything noted on the ear. So, and then next I'm gonna go ahead and do the test. The first one is the whisper test. I'm gonna say you 3 later. Just repeat after me, okay?
2, 4, 8.
Okay, he was able to say those 3 words whispering, like usually we'll whisper 2 feet away from the patient. And I'm gonna go ahead and do the Weber test. For the Weber test, I'm gonna use the tuning fork and put it in his forehead. Let me know once if you hear equally on both the side.
Yeah.
Okay, and the another one is Renate Weber. Yeah, that's Weber. And the another one is Renate's. I will be putting in back of this ear. Let me know once you stop hearing.
Stop hearing.
Okay, and now let me know if you stop hearing.
Stop hearing.
Okay, so that means like he was able to hear more in the ear than the bone. So ear conduction is greater than the bone conduction. So now I will be doing the orthoscopic exam in his ear. So for the orthoscopic exam, I'm gonna see his ear, little bit of wax and hair present. The tympanic membrane is pearl gray, and cone of the light is 7 o'clock on the left, and on the right, the cone of the light is 5 o'clock. Tympanic membrane pearl gray. Okay, and cranial number 9. Cranial number 9 is hypoglossal. For the hypoglossal, just do your and tongue out. Tongue asymmetrical. Let me see his no dental caries. Upper soft and hard palate is present. Tonsils +2. Uvula is midline. Pink and moist lips. Pink and moist gum. No gum issues. No bleeding gums. And no issues with the teeth, like no dental caries or cavities. And so that was cranial number 9. Cranial number 10 is a vagus, which is a gag reflex. We're not gonna do a gag, but we're gonna put a spatula on the patient's tongue and feel for the gag. So that is a gag reflex. And then the cranial number 11 is a spinal accessory muscle. So for that, just raise your shoulder. Don't let me push down. So that was a trapezius muscle. And another one we will do is stenographer. Turn your head the other way. Don't let me push you. The other this way. This way. Don't watch me. Don't let me push back. Okay, so that was the sternocleidomastoid joint. And cranial number 12 is a hypoglossal. For that, just press the tongue, press the cheek with your tongue, the other way. He was able to press the tongue strength. This is for the tongue strength, and he was able to perform that one. Next one we will do is a neck. For the neck, for the inspection, symmetrical neck, round, no rashes, I didn't see any rashes, any nodules, any redness or swollen neck. And for the lymph node over here, I'll be doing preauricular. Let me know. I'm palpating the lymph nodes. For the lymph nodes, it's a preauricular, postauricular, behind the ear, occipital. And let me know if you have any pain or tenderness. Okay. Submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Do you have any pain or tenderness over there? No. Okay. And now I'm gonna go ahead and do a tangential view while he's swallowing. Can you swallow? He was able to swallow normally. And now I'm gonna palpate his thyroid. So while I'm palpating the thyroid, this is the cricoid cartilage, thyroid cartilage, and no deviated trachea. Trachea is midline. So no deviated trachea. So did I miss anything over there? Neck nodes. No, did not miss anything over. Anything there. And so no tracheal deviation while swallowing. That was normal. That is fine. So next, I'm gonna go ahead. Would you mind taking off your shirt, please? Thank you. So I'm gonna go ahead and move towards the lungs. For the lungs, I'm gonna go ahead and see the chest first. Chest is symmetrical. AP ratio is 1:2. Patient is breathing non-levered normally. And for the thorax, no chest wall deformity, no excavatum and craniatum, no deformities in the chest, has a lot of hairs. Now I'm gonna go ahead and do the no deformities, symmetry. And thorax the chest looks symmetrical. Respiration rate looks normal, no nervous breathing, and that was the inspection. For the palpation, I'm gonna go ahead and palpate the chest and the sternum. Any pain or tenderness during the palpation? No pain or tenderness during the palpation. The third one, I'm gonna go ahead and do the tactile fremitus. So whenever I do the tactile fremitus, say 99, okay?
99.
So while I was doing 99, I can see the equal vibration on both sides of the lungs. I did not see any resonance. And the other one I'm gonna go ahead and do is the respiratory exertion. So for the respiratory exertion, I'm gonna do exhale, hold your breath. Now inhale deeply. Inhale the Okay, so when I was doing the respiratory exercise, my finger was the thumbs were expanded. That's a normal finding for the respiratory exam thing. So next one, I'm gonna go ahead and do the diaphragmatic exertion for the diaphragm. No, I'm gonna go ahead and do the palpate the lungs field. Any pain, any tenderness, no pain. Okay, so now other one I'm gonna go ahead and do is the percuss the lungs field for any resonance. So I'll be percussing the lungs field. Let me know. I can hear the resonance over here. I'll be palpating and I'll be comparing both the side. Okay. Now that was a percussion. Now I'm auscultating the lungs field. I'll be auscultating with both bell and diaphragm. So while auscultating, I did not hear any wheezing, any crackle, or any ronchi. So it was a normal long sound. Auscultating lungs field and I'm gonna go, can you turn back or can you just sit over here? Sit there with your back forwarding the camera. Sit there, back for facing the camera. Okay, so I'm gonna do the same thing on the back, inspection. No, spine looks straight, like a midline, spine is midline. For the inspection, no rashes, no skin issues. So for the palpation, let me know I'm palpating the lungs field, spine, any pain or tenderness during the palpation. No, okay, so I'm gonna go ahead and do the tactile parameters. Same thing, do 99 over here.
99.
Okay, so while doing the tactile parameters, again the both side looks vibrating and symmetrical. And next one I'm gonna do is a respiratory exertion. So take a deep breath while I'm doing the exertion. Okay, so the thumbs got expand. While doing respiratory exertion, I will place my thumb in the 10th intercostal spine and then it got expand. The other one I'll be doing is percussion, diaphragmatic exertion. So for diaphragmatic exertion, can you exhale and hold? So I'll be finding a doll, places over here, and then mark down, and then can you inhale and hold? So from the below, I'll just find the doll place and I'll mark those two. So those two markings over here, which is 6, and the normal is 4 to 12 centimeter, 4 to 10 or 4 to 12. So the other one we are doing is the percussing the lung field on the back and comparing both. I can hear the resonance over here and auscultating the lung fields with both bell and diaphragm. So for diaphragmatic exertion, I just did one side, but usually we do both the side. And while auscultating the lungs field, no wheezing, no ronchi, no crackles. I did that one. Palpate, respiratory exertion. You can come and sit in the chair. Now we're gonna do the cardiovascular. For the cardiovascular system, we're gonna see the chest expansion. So the chest expansion is equal. Take a breath. So yeah, the chest expansion is equal, and the other one I'm gonna go ahead and do is palpate. I'm gonna palpate the sternum and the chest. Let me know any pain or any pain, any
No pain.
no pain. Okay, and tenderness.
No.
So now I'm gonna go ahead and do hear the lungs, heart sound. So I'll be hearing with both bell and diaphragm. So for the I'm gonna hear the apical right intercostal, right sternum, second intercostal border, aortic. Aortic. Second was pulmonary, pulmonic. Second sternum, left intercostal border. Third one is Erb's point, third intercostal left sternum border. Tricuspid, fourth intercostal left sternum border, and a mitral, fifth intercostal border. I'm gonna repeat with the bell, the same one, aortic, pulmonic, Erb's, tricuspid, and mitral. So for this one, I'm gonna do it with both sitting, and I'm gonna go ahead and do it sleeping. So before doing with the sleeping, I'm gonna do the carotid pulse. So I'm gonna be palpating. So for that, patient will be turning 30 to 45, and then I'm gonna do one at a time. So I'm gonna palpate over here, touching, no thrill. So I did one by one, and then no bruit or thrills. So for the chest, for inspection, no hips are left. I did not see any hips are left on inspection, and then again on palpation, no hips are left. So for the carotid, I'm gonna go ahead and do auscultate with both bell and diaphragm. Okay, so no thrills, no bruits. I did with both diaphragm and the thing. And the next one I'm gonna do is a point of maximal interest or the apical pulse insect. So for that, patient will turn on the left side. Just turn, not the chair, you. Yeah. Just on the left side, and or you can sleep. Can you sleep? And go ahead and sleep over there. Lay down. So I'm gonna go ahead and do the chest exam with the auscultate while he's sleeping. I did while he's sitting, and now I'm repeating while he's sleeping again. Second sternum border, right intercostal, aortic, pulmonic, Erb's, third intercostal, left sternum border, tricuspid, fourth intercostal, left sternum, and mitral. So I'm gonna do with the both bell and the diaphragm, all the 5. And for the PMI, just turn in the left side. Here, turn the left side.
This.
So while he's turning the left side, I'm gonna do his PMI on the apex, which is the 5th intercostal left internal border over here. So I can no bruit or thrill heard on the PMI. Just for sternum for tenderness. So I palpate the thrill. Okay, now I'm gonna go ahead and do the abdomen one. For the abdominal one, symmetrical abdomen, no bulging abdomen, no ascites, no jaundice, no sinuses, excessive hair growth, and then no jaundice, no pallor, skin color normal to the ethnicity. Now I'm gonna go ahead and do the auscultation on all 4 bowel quadrant, like right lower, right upper, left upper, left lower, with both bell and diaphragm. No hypo or hyperactive bowel sound noted, and the next one I'm gonna do is the percussion on all 4 sides. resonance sound heard, no dullness, so that means no fluid feel, no ascites over there. Now I'm gonna do a light and deep palpation. First I'm gonna go ahead and do a light palpation. Any pain or tenderness?
No.
No pain, no tenderness. Okay, so and no pain or no tenderness, and now I'm gonna go ahead and do the percussion of the lever. So while percussion of the lever, I can hear the dull sound like on the lever. No resonance, I can find the dull sound. And for percussing the spleen, so while percussing the spleen, I can hear the dull sound for the spleen. So I'm gonna go ahead and do the lever span. For the lever span, I'll be percussing the lever, finding the dull side from the upper side of the in between the rib cage, mark the point, come back from the umbilicus, twisting up, and then find the dull point over there, and then mark the point. And then I'm gonna go ahead and measure those 2 points for the lever span. It's measured 4. The normal is 3.5 to 5. So now I'm gonna go ahead and palpate the lever. The lever is not palpable, which is a normal finding. That means no enlargement. Palpating the spleen. Any pain, tenderness? While palpating the spleen, no pain, I cannot palpate the liver. That means no enlargement of the spleen too. So next one is, I'm going to go ahead and palpate the bladder and percuss the bladder. So bladder is dull, which means there is his bladder is full. So next, I'm going to go ahead and do the abdominal artery, aortic arteries, which is above the umbilicus. I'm gonna find the renal arteries, no bruit, no trills, iliac arteries, no bruit, no trills, and femoral arteries, no bruit, no trills on the femoral. So for the femoral, I will not remove the close. I just did the close, and then I'm gonna try to find the lymph node over here. On the femoral, no loaded lymph node, and then I will find no abdominal masses while palpating on the aortic artery, no abdominal mass, and no palpable mass in the aortic artery. That means no abdominal aneurysm. So if we can palpate any mass, that means no abdominal aneurysm. Okay? Stand, get up and stand over here. So for the inspection of the abdomen, no pulsation, no contour, no hernia. So bowels are auscultated. Now I'm gonna go ahead and do the spine. Can you just stand up for the spine and towards the other side? So for the spine, I'll be looking the spine, palpating. For the inspection, no rashes, no like skin looks normal, no lumps, no rash, no redness, no papules, no erythematous. So, and for palpating of the span, any pain or tenderness during, no. Okay, so can you bend down for the, while bending down, no scoliosis, no kyphosis, no kyphosis, and no lordosis. And okay, while he is down, can you get, that is your flexion. For the extension, just bend your back up. Okay, for lateral to the left and to the right. So that is his range of motion for the spine. And for the cervical, you can sit here. For the cervical, for the neck, can you just flex down, flex up, left lateral, right lateral, and then rotate your neck. So he was able to rotate his neck. For the inspection of his neck, symmetrical, round, no rashes, no redness, no nodules, no papules. And now I'm going to go ahead and do the upper extremities like a finger. So for the fingers, inspections, no deformities, no swelling, no redness, nothing. For the movement, just make a fist, range of motion. Okay, open it. And then adduction, abduction, adduction. Okay, and for the palpation, no any pain or tenderness. No pain, no tenderness. Okay, so for the elbow, I'm gonna see the elbow, no redness, no pain, no redness, no deformities, no swelling. And for the palpation, I'll be palpating the medial nerve, ulnar and radial nerve over here. Any pain, any tenderness? No. For the range of motion, do flexion, extension, abduction, adduction, abduction. Okay. So for the elbow, no redness, no swelling, no scars, no swelling, no deformities. And for the palpation, any pain or tenderness? No. No lymph node noted while palpating. And then for that, flexion, extension, and adduction, no, flexion, supination, pronation, supination. Okay, and for this one, we're gonna go ahead and do the reflex over here. So for that, I'm gonna do a brachial reflex, trachea, and brachial, and radial. So radial reflex over there. Okay, and for that one, for the shoulder, no redness, no deformities, no swelling noted. And for the palpation, any pain or tenderness? No. And for the shoulder flexion, extension on the back, and then shoulder rotation, adduction on your back. Okay, and for the upper extremities, we're gonna do the fit test. So can you close your eyes and tell me Salvador?
Sharp, sharp, dull, 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 sharp, dull, sharp.
Okay. And now I'm gonna go ahead and do the lower extremity. For the lower extremities, I'm gonna do the knees. For the knees, no deformities, no redness, no swelling. For the palpation, any pain or tenderness? No. Okay. And for your hip, no redness, no swelling, no deformities, any pain or tenderness on the hip joints? No scoliosis, no life. And for the feet, can you go sit over there? For the feet, no sinuses, capillary refill within 3 seconds, no deformities, upper inspection, upper palpation, no swelling noted, any pain or any tenderness. No. Okay, for the legs, just do the flexion, extension, adduction, and abduction. Okay, and I'm gonna do the pulse on the legs when I'm there. So for the pulse, for the popliteal pulse on the back, pedal pulse on the leg, and tibial pulse over there. And I'm gonna go ahead and do the reflexes. So I'm gonna do the reflex over here, and then here, and the Babinski reflex over there. So, and for the Salomon doll, close your eyes. So let me know if it is Salomon doll.
Sharp, dull, sharp.
Okay, and can you lie down? Okay, for the range of motion of the knee, just flex, extend, adduct, and abduct. And for the hip, the same thing, extend like up. And for this is flexion of the hip, extension of the hip, just go to the back, like the leg goes back, and flexion and extension, adduction and abduction will be the front over there. Okay, you can get up now. You can have a seat over here. That is it for your wellness exam. Thank you so much, Visa.
Thank you.